I'm unmuted now.
Hello, my name is Andrew Jack from the Financial Times, and it's a pleasure to welcome you all here today for our discussion over the next hour on rethinking the future of cancer care. So welcome on behalf of the FT and the European Federation of Pharmaceutical Industries and Associations. Thanks to FPF for partnering with us. And a reminder that today its report on innovation for sustainable cancer care has been published, and you can download that from the FT Live website. So we're going to talk about the challenges ahead, and just a word on housekeeping. Do please, during our discussion, use the chat function box on the right-hand side of your screen to ask questions, and I'll come to those towards the latter part of our hour-long discussion. And you can also share any thoughts on social media at #FT-Health. So we're talking today about the needs, but also intense challenges of tackling cancer, one of the biggest diseases that affects people across Europe and indeed around the world. We're going to explore some interesting models of innovation and try to understand what the next steps could be for industry, for regulators, for physicians and others tackling. So we've got our panel here, and we're going to begin with some remarks from Sarah Said as MP, who will set the framework for our discussion. Sarah, over to you.
On the first talk. Hello, everyone. Good afternoon. Thank you very much for having me here. It's a quite honor to be here today and talk about the importance of the work that is done in this regard, especially on the future of cancer care. We have now that every minute more than 5 new cancer patients are diagnosed in Europe. And even though cancer outcomes have improved greatly in the recent decades, cancer incidence, meaning new cases of cancer, is rising, and this is partly due to demographic changes. We also have that 40% by deaths of 40% of deaths by cancer could have been avoidable, and that we still do not know what causes half of cancers. We know what are the 50% known risk factors for cancer, but the other half we still do not know. So there's a long way ahead. And here in the European Parliament, we have approved a report on the Europe's Beating Cancer Plan with a special focus on prevention, early diagnosis, accessibility and to cancer care for patients, appropriate cancer care, and also the quality of life, not only for patients, but also here, including their families. And indeed, this has become an expensive battle, and sustainability should be key in every healthcare system, now more than ever. And the answer here should lie in innovation, research, and development when it comes to science and technology, in order for us to revert the current trends and improve morbidity numbers, but also lower the mortality numbers. With this, I would like to welcome the FPIA's oncology platform, together with the sounding board of experts composed more than 20 European organizations, have put the spotlight on 30 initiatives which can address the current challenges in achieving high quality cancer care. This is through innovative platforms and procedures, smarter use of health budgets to make more cost-efficient practices, but also more environmental sustainable practices. And this reveals great opportunities and efficiencies across the whole cancer care pathway, from prevention to diagnosis, treatment, and palliative care and survivorship. So the report points to 5 key trends in innovation, such as artificial intelligence and machine learning, digital health and digital medicine, precision medicine and biomarker testing, curative and capacity extending therapies, and out-of-hospital care. And in this report, it also urges us policymakers to commit to 5 areas, namely more ambition to adopt policies that put patients and outcomes that matters first, a more patient-centered care, investment in the research and development to make fundamental and have fundamental changes, to have more evidence, data, and analytics to maximize the impact and scale of care, reimbursement for healthcare organizations who implement sustainable practices, and lastly, clear progression pathways and networks to scale up successful pilot projects in order to foster innovation. And I truly stand with this call of action, and I would like, before finishing these quick introductory remarks, to share 3 examples of successes from this white paper that should be highlighted. One is that Mara Milok will speak later into more detail, that is being implemented in Portugal and other countries. And it has received the maximum score in assessment in the Horizon program and is now funded with 7 million euros. It promises to diagnose breast cancer earlier without radiation or pain, and it is cheaper than current methods. The second example I would like to bring here is the artificial intelligence application that is able to monitor patients with lung cancer at home, and it reports increased quality of life and a decrease in hospital admissions and emergency room visits. So better quality of care without more resources being used within the healthcare system. This is a truly example of efficient in the cancer care. And lastly, another example would be on reimagining cancer network to favor best practices sharing and expertise exchanges. across member states, especially when it comes to rarer forms of cancer. So this is only examples that show how the ambitious policies that we have highlighted through the Europe's Beating Cancer Plan and the recommendations that we have done in the Special Committee on Beating Cancer here in the Parliament are met with ambitious people like you here that are following this event. This is why that the power of changing the future lies with you when it comes to cancer care, and only together we will be able to make this a truly success to be achieved. So I would like to thank you very much again for the opportunity to be here with you.
Thanks very much, Sarah. And I know you have to go in a minute, but just to frame this, so give us a sense. Obviously, health is largely, as we know, a member by member rather than EU function. What's the extent to which do you think the European Parliament and you and colleagues can drive forward the EU Cancer Plan to try to leverage the scope, as we were describing, for innovation?
Sorry, I lost connection for a moment in your question. Can you briefly repeat it?
I was saying, what's the scope for the European Parliament and you with your colleagues to drive forward the EU Cancer Plan, given both the political and indeed the economic challenges across Europe and the fact that obviously health is primarily done at the national level?
Yeah, well, actually, I would like to highlight that health is not done primarily at the national level. It's the provision of care, healthcare, that it's done at the member states level. But the protection of public health is a joint competence between member states and the European Union, and this is where we're trying to strive through better innovation, better strategies when it comes to this disease that it accounts for the second cause of death in the EU. And this is why it's important to have fora like this one that we are here now today to discuss how to better streamline and how can the EU be a guidance when it comes to innovation and research. Just to give you an example, now we're talking about scarcity of oncology medicines in the EU, a bit all over the place, and a bit all over the EU. And how can the EU the big question is how can the EU foster innovation? And I think one of the questions here lies with Horizon Europe and making sure that these networks are integrated. Because if we deal with health as a EU, as 27 member states, 450 million citizens, we will have necessarily better outcomes.
Okay, well, look, thank you very much indeed for that. Do please stay if you can. But let's now hear a little bit more about the contents and the findings of the FPIA report on innovation for sustainable cancer care. So I'll hand over now to Marie Sharmila Blandino, who's Global Access Strategy Lead for Oncology at Amgen and Vice Chair of the European Federation of Pharmaceutical Industries and Associations Oncology Platform.
Thank you, Andrew. And I would like to say, Honorable Member of the European Parliament, Sarah Cerdas, thank you for supporting innovation for sustainable cancer care, because it is urgent to sustain high-quality cancer care by putting innovation and patients at the center, because it is possible to sustain high-quality cancer care if we innovate, despite the growing pressures on our economies and healthcare systems. Together with more than 20 European stakeholders, we listed in this white paper 30 real-world examples that demonstrate how innovation makes cancer care sustainable, from prevention to early detection and treatment of cancer up to survivorship. Why did we do that? Because it is time to change. 5 new cancer cases are diagnosed every minute in Europe. Cancer has impacted or will impact every one of us, if not directly, then indirectly, through our friends, our children, our parents, our siblings, or any loved ones. This trend will accelerate due to population demography. To meet the increasing demand, we need more resources that we may not have, with European member states being impacted by multiple crises, the pressure on health workforce, and the pressure on hospital capacity. Currently, Healthcare, financial, human, and material resources are at risk. Imagine, by 2030, Europe and the UK will be missing 4.1 million of health workers. In parallel, Europe's Beating Cancer Plan and the Cancer Mission have the ambition to revert the trend so that cancer does not become the leading cause of death in Europe. Their goal is to improve 3 million lives by 2030. This requires investment. Our proposal is to urgently make smart investment in innovation for long-term sustainability of the healthcare system while providing better outcomes for cancer patients in Europe. Let me give you 4 examples out of the 30 cases that we highlight in this white paper. Innovation can accelerate diagnosis by using artificial intelligence and machine learning. In the Netherlands, radiation oncologists decrease the reading time of lung cancer CTs by 40% and improve image segmentation 30 times faster. Innovation can boost home-based treatment by using remote monitoring techniques, for example, so that cancer patients can stay next to their family, while it frees up resources, physicians, nurses, and hospital beds that can be used for other patients. In Italy, 98% of the patients who benefited from home-based treatment for their cancer preferred it compared to being in the hospital. Plus, it saved resources. Of course, this type of decisions need to be made on a case-by-case basis, but it is a powerful message. Innovation can support the well-being of cancer patient survivors. We took the example of a Spanish hospital that used EL solutions to provide group therapies for teenagers and children who survived cancer. And innovation can reduce carbon emissions. In England, an hospital cut by 80% the carbon emissions of a surgery by using different techniques, including wearing reusable scrub, decreasing the energy use, and performing anesthesia in IV. So, in conclusion, FPIA Oncology Platform is proud of this collaboration with the Sounding Board of Experts on Innovation for Sustainable Cancer Care. We represent 19 companies and 17 national associations, and it is important to us because it is aligned with our mission. Healthcare and innovation is an investment, a long-term investment as opposed to a cost. We encourage you to read this white paper and to determine how you can invest in which innovation in your geography, in your remit. We would like also to thank all the healthcare professionals who dedicated time and resources in the innovation we mentioned in this white paper. Because by investing in innovation, we will improve patients' outcomes in Europe for the long term, as well as make the healthcare system sustainable. Thank you.
Thanks very much, Maria Shamila. Just tell us briefly, so now the report, which obviously has highlighted a number of interesting approaches and innovative ways to progress in terms of cancer treatment. What are the next steps that you see? What needs to now be done?
Thank you very much, Andrew, for that question. And indeed, we are very mindful with the Sounding Board of Experts that achieving sustainability of the healthcare system is a long journey. We started this work already a year ago. This white paper is one step out of many more. Actually, next week, we have our next Sounding Board meeting where we'll discuss about what are our priorities for this year. With this white paper, we want it to be useful for the European Commission and member states in achieving their dual ambition to provide healthcare system that is fit for purpose, while also providing affordable medicines to its population, while also supporting industry to remain a world leader in medical innovation. So many more steps to come. This is a long journey, and we are really delighted by the collaboration with the Sounding Board of Experts.
And obviously the case studies that you highlighted, all individually quite powerful. Like any one in particular where already there's some pretty compelling high-level cost savings, efficiency savings that have demonstrated a real ability to step up and escalate and take advantage of more efficient approaches to cancer care.
Yes, absolutely. And I really encourage everyone to read the white paper, one that I mentioned on the home-based treatment. Of course, from a financial perspective, it saves money, and we highlight it in the report with some figures. But more importantly for us, it's really to show that what is important is to have a global view of the resources instead of a silo view. And it's about investing better the financial part, but also using better our resources like healthcare professional resources so that they can take care of more patients with the same number. And those are elements that we also want to highlight in the true impact of innovation.
Okay, well, thanks very much. So let's now move to our broader panel discussion on these issues. Perhaps I'll start with you, Tanos Cosmides. You might want to just briefly tell us what Care Across, of which your CEO is, but then let's think about this issue of the challenge that we face in Europe at the moment and the need and the feasible response given obviously the wider tensions and particularly both geopolitical and economically the constraints that healthcare systems are facing. Thanos.
Thank you, Andrew, and thank you, FPIA, for bringing us on board as a sounding board member. Just to remind you, beyond being a CEO of Care Across, I also represent All-Can International, a global nonprofit focusing on cancer and very much aligned with the efficiencies in cancer care that also these reports wants to instill. Andrew, your question is excellent and it's very broad, as is this topic, right? I'll try to address a couple of points here. I think that it was evident in the points we heard before that there's still a lot that can be done, and there's still a lot that is being done, and we can measure the impact. So we had a lot of percentages and numbers, and you know, improvements that can be made. I think that in this report, what we see is that there are not just pockets of opportunity, there are systematic improvements that can be done across the healthcare system. Let me take a step back and start addressing some of your points. Already mentioned that All-Can is a global nonprofit organization focusing on cancer and really passionate about efficiencies in cancer care. Care Across is a digital health SME, indeed focusing on cancer as well, very much taking a digital first and patient-centric approach towards quality of life of cancer patients. And what we have seen across both these organizations that are collaborating on several fronts is that there's a lot of things that we are still missing in understanding the patient journey and really putting the patient at the center of care. So real briefly, I think this report really does an excellent job in actually identifying and elucidating on those particular stages that go beyond the very, you know, the medical components of cancer, the medical journey, but talk about, you know, the early diagnosis all the way through survivorship and palliative care. So in essence, the call to action here is to look at the big picture, measure as much as we can, measure it in a structured way, and then try to collaborate together, innovate together, not just look outside of our silos for innovation. See what we can expose, what we can extend in terms of opportunities for others to work with us. And this is something that very much throughout these discussions I've seen very strongly. Thank you.
And the challenge, though, often, isn't it, is that new innovations come in but provide, in theory, savings and benefits, but actually often are incrementally adding cost and quite difficult to engineer into existing healthcare systems. Any thoughts about approaches you've seen that can tackle that issue to ensure there are actually efficiency savings that improve patient outcomes without adding extra burdens to healthcare systems?
So Maria already mentioned, and I completely agree, that we should look at it as an investment and not as a cost. Of course it is a cost, and of course it's borne by the citizens, and the member states. But we have to recognize that there will be the investment will have this initial cost, which will have to actually have a way to measure the impact of. One suggestion is, if I may, think a bit more agile and try not to boil the ocean, if I would be allowed to use this phrase. So many steps that can affect hundreds, thousands of patients. So many incremental improvements that can be done in a way that does not really require a lot of investment or cost, whichever way you want to see it. So let's try to identify and unbundle these big problems that affect so many cancer patients, their families, and the healthcare systems, and try to see where we can make the biggest impact in a structured way, in a collaborative way. So small steps, incremental, measurable, and impactful.
So thanks. So let's try to drill down a little bit at a couple of examples highlighted amongst elsewhere in this latest report. Tamara Huso Milagre, so you're the founder and president of Evita Cancro Hereditario. Tell us a little bit more about MammoScreen, this project around improving breast cancer screening accuracy and inclusivity. How's it approaching the situation, and what's the benefit that you're seeing?
Yeah, thank you very much for your question, and thank you for having me also in this digital conversation. So this European project, MammoScreen, is a game changer for breast cancer screening. As we all know, breast cancer is the most frequent cancer in the world. And if we go after the numbers of WHO's International Agency for Research on Cancer, we see figures in 2020 that show that 24% of all cancers in women, that means 2.26 million women, and 685,000 deaths globally are due to breast cancer. So we have to improve a lot regarding this disease. And so Evita integrates a consortium on an important European Cancer Mission project called MammoScreen. I need to outline again that the proposal was evaluated with the highest score possible. So 15 out of 15, that is almost not happening, but it happened here. So the expectations are very high, and that's perfectly justified. I would say we are going to witness a global revolution in breast cancer screening. So imagine you are a woman. I mean, I represent the community of hereditary cancer. Hereditary cancer affects now, regarding breast cancer, 5 to 10% of breast cancer is hereditary origin. And our population has a very early onset of disease. So in most cases, women have very dense breast tissue, which is not really easy to screen. And with the MammoWave device, that's the name they gave it, you can basically close all the gaps that a mammogram leaves open in breast cancer screening. So you have a completely pain-free, female-friendly, comfortable, radiation-free, and even cheaper possibility to do breast cancer screening with more specificity and more sensitivity even than mammogram. And I think all women would agree that doing a mammogram is not really a very comfortable situation, and it's really very painful. We're talking about 18 kilograms of pressure on your breast, And then there is also the aspect that you have to undress yourself in front of a technician, and there may be cultural backgrounds that do not go to breast cancer screening due to that fact. So with mammoscreen, you just lay down comfortably on a table, face down, and you have a cup and you have antennas inside there, and on the basis of microwaves, you have a really very specific and sensitive image of your breast tissue. So in this project, there will be included 10,000 study participants. Those women have all indication for breast cancer screening, or due to their age, or due to high risk because of their genetic predisposition. So they do first their usual screening, and then after that, they do mammowave device screening. The results go up to a cloud, and with the help of artificial intelligence and machine learning, the results are immediately compared and processed. And then we will hopefully, and I'm really optimistic about that, understand and learn the huge value that mammo wave device will bring to society and healthcare systems.
Thanks. So powerful description of one of those interventions. Now there's about 30 in this white paper that's just come out, which go from prevention through early detection, as you were describing, through to treatment, and also, of course, very important, cancer survivorship post-treatment. Any thoughts of other ones amongst those examples in the white paper that you think have the potential to have the greatest impact on sustainability despite the resource constraints we've been talking about?
Yes, there is also a suggestion of a project that identifies genetic mutation carriers and improves quality of life and outcomes for them. And I really would like to notice that from our side, I think that's also interested, initiative from a patient organization. We identified we do not really have data on hereditary cancer. And if you do not have data, you won't gain knowledge and you won't develop further. So our National Cancer Registry does not discriminate hereditary cancer from sporadic cancer. That means it simply doesn't exist. So we decided to create patient-generated data bottom-up with our project Evita platform, which also aims to be a virtual shoulder to lean on and a personal assistant of the pocket. Because we learned during pandemic that prevention and screening for high-risk patients was completely abandoned. And of course, we are paying very, very strongly now the delayed cancer diagnosis of a type of cancer that could have been avoided. And we will be able, with our platform, to evaluate the cancer risk score of a user, of a platform user. We can provide personalized health literacy with the help of artificial intelligence. We can inform regarding clinical trials going on all over Europe, and many more features. So the project that is pointing out the hereditary cancer community in our report is also the other one, which I think will make a huge impact, because hereditary cancer with early onset of disease is obviously the most expensive cancer of all. If it hits a 27-year-old pregnant lady that has 2 little children at home and she dies 2 years later, that is, besides the socio-economical impact, a tragedy that we should not allow in 2023.
Well, thank you very much for that. And of course, it's really important to put front and center the voice of the patient in tackling cancer. But let's now shift a little bit to the political and the institutional constraints in tackling or engaging with innovation in cancer. Let me turn to you, Professor Patricio Andre Achimas Codaro. So you're president of the working group for the fight against cancer in the Parliament of Romania. So we've heard a lot about the potential for innovation in the full range of activities through prevention to treatment. But of course, politically and in terms of budget cycles, those long-term innovations often come up against the constraint of the short-term priorities and budget restrictions that exist, don't they, in countries across Europe and around the world. So how do you think we can do more to ensure that people and the health systems can benefit from innovation?
Thank you, Andrew, and thank the organizer. So it's an easy question, but complicated answers. Actually, a brief history. We got elections in 2020, and at that time, due to the pandemics, it was quite fashionable to be an MD. So we ended up with a few MDs in the parliament, and we thought what we can do best of it. And one idea was the NCCP, the National Cancer Plan, because we had none on one hand, but on the other hand, there are two things that changed everything. First, the Euro-beating cancer plan, and secondly, the large cohorts that will reach their fifth, sixth decade, coming back from Ceausescu's politics of increasing natality in Romania. So no contraception at those dark days, you remember maybe. And these cohorts now are in their decades of high risk of getting cancer. So this is a very significant problem of our society. And as you mentioned, of course, money is always a problem, especially in countries with low or middle incomes, which is the case for Romania. Still, if we look at the investments in healthcare, I think this would be the perfect timing, because I don't think that there will come another generation with Euro-beating cancer plan around. So this is how we ended up with our NCCP. Now, of course, money is a significant problem, and we face this problem too. Still, as mentioned before, new technologies as AI can change pretty much paradigm in terms of prevention. As far as treatment is concerned, we have the new paradigm here already, and this is personalized medicine, and all these things we are looking forward. Of course, we have different problems in comparison to other Western European countries. Top 5 cancers, we see cervical carcinoma. And there's a problem with screening. Of course, we don't have, apart from regional nets of screening, we don't have like a national one. Still, we have the vaccination net organized for Corona. So we think that we could use that net in terms of increasing our modest rate of anti-HPV vaccination, and so on and so forth. But if we go and think of high-value medicine, when we'll go to purchasing, we might think of intelligent ways of purchasing. Instead of purchasing vaccines, we could purchase, for instance, a rate of vaccination, meaning that the ones that provide the vaccine should take care also of information of organizing the vaccination itself. So I think we, by spending, of course, at this moment we spend like for €1 in Romania, Germany or a Western European country spends like 8 to 10 euros. Of course, we can't afford to spend 8 or 10 euros, but I guess with an intelligent, high value purchase, we might spend 3 or 4 euros and get the result of 5 or 6. This is how I see things in this regard.
Yes, so an important point there about trying to shift from a sort of commodity or transaction based to a more systemic performance or outcomes based approach to tackling cancer and other healthcare issues. Just before I go back for a broader round, sticking with you, Patricio, I mean, just on the interaction between national governments and the EU and thinking about the new EU cancer plan, I mean, how important is that, do you think, at the national level? And how much is there a need to update national cancer plans to align with it and drive progress in benefiting from innovation?
When we started working at our NCCP, of course, we had the ECL template. But on the other hand, we already had the Euro-beating cancer plan, meaning that we, of course, we followed all the pillars there, but we adapted our NCCP to the Euro-beating cancer plan. And that's very important because whenever you have a low budget for healthcare, you should look for everything possible. And of course, you beating cancer plan comes with plenty of money. On one hand, we already we have money from the resilience plan and already started our center of competence in cancer. And I feel that the net of center of competence in cancer, all these nets for center of competence will help in tightening these gaps that we face in different parts of Europe.
Okay, so I'm going to go in a few minutes to some questions. So do please remind us, those of you watching, please post your questions and wider reflections on this important issue of uptake of innovation in cancer care. But let me just do another round to each of you, just trying to distill that issue of the fundamental barriers you see to smarter spending, as we might call it, to improve outcomes despite both the financial and the institutional and political constraints in the system. Thanos, briefly back to you, please.
Absolutely. There are barriers aplenty, right? There's plenty of barriers in any kind of systemic innovation, especially when it comes to healthcare, especially when it comes to cancer, if I may add, because it's a chronic condition which you cannot really associate and attach causality to many of your innovative activities. However, having said that, what we have seen both through AllCan, where we do monitor innovations like these, but also at Care Across, where we implement, will design and implement such innovative activities, is that if we put our entrepreneurial hats on for just a second, we need to really listen to the needs of the stakeholders. And I've been very clear in the past few minutes talking about patient centricity. So it's very hard to actually design something around the patient if we don't have a very keen way to actually listen to the patient needs, the patient experience, the patient insights, and really in a measurable way. So, for instance, a lot of the engagement we have with patients across Europe through Care Across is around their unmet needs, is around the quality of life. And a lot of times what we see really is different from what is out there and captured in clinical trials, for instance. And so revealing these insights and uncovering some trends, some patterns, some unmet needs, I think it's a very important first step to actually show the world and then reach out to those innovation networks try to identify those partners, those potential partners. And there could be industry, it could be academia, it could be individual researchers, clinicians, oncology nurses, a very broad gamut of individuals or organizations or groups that have experienced such challenges and can contribute to either piloting things out or to actually designing and executing innovative activities. And I'll plug something which is not something that we're doing. That's not what I'm here for today, but it's part of the report, and it was really intriguing for me because it talked about geriatric assessment in the context of palliative care. And this is such a clear-cut need, right? Because of the demographics of cancer, because of the needs of patients in palliative care setting. And this was implemented, and this had real results, measurable results. So I think listening to those unmet needs and communicating them broadly will be the first seed to actually grow and innovate.
And Tamara, what do you see? We've talked about the potential for innovation, but what do you see as the one or two key constraints or challenges to the uptake of these new approaches?
First of all, we need to guarantee sustainability because the rising numbers of cancer cases, not only in the elderly population, but also we have, for example, breast cancer at young age is rising steadily. So we need to prevent waste, to be prepared to guarantee sustainability. The sustainability of the system depends on the prevention of waste and disease. So we also need to bet strongly on prevention. We are always focused on the remedy of the already sick people, which is super important, no doubt about that, but we cannot ignore the prevention. And the other thing is we need to start to take action because we have already many very good documents to improve quality of life and care for cancer patients. But I don't see it happening. And that may depend also on the cycle of governments, for example, because there is an investment needed. Again, if we prevent waste and disease, we will have more money. But the other thing is also we need to commit to a medium-long space that all those investments will take. I mean, any investment you do in health will show outcomes much later. And then the laws go to a different government, for example. We need to commit on European level and during several governments that we need to change completely how we treat cancer and cancer patients, because how we do it now will not going to work in the future. So if we have all these very smart recommendations of with many input from a lot of people that work around cancer, just follow it and do it, because it's done with including also the high needs of cancer patients. So that is what we need to do.
Yeah, so Patricia, as Tamara was just saying, the long-term benefit versus the short-term cost of innovation and the challenge of fitting that in with budgetary and political cycles. What tangibly do you think you and other politicians can do to try to tackle that?
This is something that we will have to see, because with changing of governments that quickly in some parts of Europe, these things become quite complicated. And it's obviously other things that are important now in all the sociological inputs that we see, like taxes and cost of life, and healthcare is not top three in our country, for instance, at this moment. This means that whatever we are trying to do, I feel it's good for everybody. But when people think this way, politicians, of course, I don't want to say I'm not at the moment one of them, but when you think in terms of political issues and number of votes, it means that all these other subjects will just go lower and lower in the interest. And there's a war at our border, for instance, and we have refugees and so on and so forth. And maybe cancer and doc MDs will not be that fashionable in the next elections. We already see that we prepare for them. So I realize that these things are not the same all over. Europe still, we see very much of this type of politics, not my type, influencing the decisions and, of course, the way things are financed. So, as mentioned before, I think patients' organizations are the ones who should be very much involved, as we did when elaborating the NCCP on one hand, but also be the ones that verify and somehow amplify this message, because otherwise, if we will rely strictly on sociological measurements, we'll end up with postponing all this, I would say, good work that we did. So I guess the answer would be patient societies, of course, all actors involved having the chance of being vocal and speaking out loud.
Okay, so thanks very much. We're going to turn it over now to some of the questions we've had. Thanks for those watching who've been sending them in. First of all, perhaps there's one here about the lack of sufficient focus, perhaps, on cancer in children, where medicine development is more challenging than in adults. How to particularly focus on greater innovation and greater uptake of innovation for that. I don't know, Shamila, is that something you might like to touch on briefly? You on sound? Oh, don't hear you.
Yes,
yep.
Hi.
Please,
I'm back, I think, with the technique. So thank you very much for all the questions, actually, that are posted in the chat. Actually, pediatric children cancer is very preoccupying, as well as adult one and elderly one. Through this report, we wanted to really highlight that innovation at any part of the healthcare system, of the patient journey, is important, whereas it's for all type of cancers, for all ages of cancer types. So what we want to highlight is that there are unmet needs still in investing in innovation in so many areas. We can speak about treatment, and maybe this question referred to treatment, but it's much beyond for that. It's also about early detection. It's also about helping the well-being of patients. It's also helping physicians, the workforce that is in shortage at the moment, to have the right time for the right patients at the right moment as well. And all of that is also about investing in innovation, because innovation can help better manage our resources for any type of cancer patients. Whereas it's because, as I think Tamara mentioned it, it's about preventing cancer. This is the goal also. How can we use innovation to prevent more cancers? But also early detection is a very important element. On if we detect a cancer earlier, then the type of treatment or the patient will be managed earlier, and the chances of the outcomes will be higher in terms of overall survival, for example. There's a lot of literature about it. So it's also a way to better use the resources of the healthcare system, including also the resources of physicians who take care and nurses who take care of this type of patients, because patients having better outcomes need less to go back to the hospital and go back to their life as well. So what we want to highlight is this white paper is that there are many areas where innovation can prove to support the sustainability of the healthcare system for all cancer patients. Thank you.
No, thanks. And you touched on there another of the questions that's been raised here by our viewers around precisely the healthcare workforce and what innovation is required to tackle that. Of course, it's a much wider issue than purely around cancer, but a different form, as it were, of innovation around human resource at a time, as you were saying, Marie-Shamila, where there's been a big departure at a time when actually there should be a growing need for human resources in healthcare. I don't know, Tamara, would you like to touch on that at all? Do you think what could be more done around the healthcare workforce?
Yeah, the healthcare workforce is almost collapsing. That's a fact. I mean, difficult times are behind us and more difficult times are in front of us. And during pandemic, there were a lot of healthcare professionals that abandoned their job because they couldn't stand it anymore. Mainly nurses, for example. There was a big shift in nurses to look for other jobs. I think it's very, very difficult. And also, what is the motivation for the healthcare practitioners? Because they are not recognized as they should be, and they do not have, in many cases, the minimal conditions to perform their work as they should do. And there we come back to innovation. How many doctors want to prescribe innovative medicine for their patients, and they cannot get access to this medicine because of a medicines agency that is of another opinion or whatever. I mean, they swear to care about the patients the best possible regarding best practice and gold standard, but it's not always possible. So I think that's really a big problem, and we must bet on the new generation to create interest that they want to go in this direction in the healthcare industry. I'm a nurse by myself, by the way, and I am not working anymore since 2014 because I really didn't feel well treated in the system. And I lived helping other people in my patient organization. So, but I was in the system, and the way it works, there are some things to change, and we need more motivation for them. This is not only regarding money, that's much more complex, not easy.
So Patricia, there's a specific question for you, which I think is a very important one. So they say, could you go into further details about the innovative purchasing mechanisms for high-value medicines that could be used in countries like Romania?
Yeah, sure, Andrew. Thank you. I mean, I don't think it's only Romania here the case, because we know that graph. We all know that graph that spending grows, and what we get out of it at one point flatters, yeah, but also descends. And we know that there are countries, wealthy countries, that spend a lot and don't get that much in terms of their investment. Coming back to the principle, high-value medicine or high-value surgery, in my case, for instance, it means that we are not looking for a specific medicine or issue for itself. As mentioned, vaccines. This is a very simple example. I will give you another one in a minute. So instead of purchasing 1,000 vaccines, let's ask for a rate of 30% vaccination rate in women between, let's say, 12 years old and young girls, 12 years old to, I don't know, 20. I mean, it depends, of course, on different countries, on the incidence of cervical cancer. But for my country, for instance, we might look also for young ladies that are over 14, for instance, or 16. Instead of asking for vaccines, we might ask for a specific rate of vaccination, meaning that we can ask the ones that produce vaccines to be part of the whole enterprise, meaning that they will be also involved in information, in setting up the centers for vaccination, in discussing with parents, and so on and so forth. Another example, instead of asking for colostoma bags, we might ask for a certain quality of life of our patients who need stoma bags. So it means that we're not buying the best stoma bags, but the best solution. We're asking for solutions, not for products. And if we will start thinking in this new paradigm, I guess we'll end up, of course, it might be a higher price at the beginning, but we might end up with a better outcome for our patients, because this is what we're looking for in the end. We're not looking for R0 surgery. We are looking for survival and quality of life of our. I'm a gynecologist. I'm dealing with ovarian cancer, and most of my colleagues are the R0. We perform the perfect surgery. This is not the case. We're looking for survival and quality of life of our patients. This means in a multidisciplinary way, we should tackle these patients. It's more or less the same here. Not asking for vaccines or for stoma bags, looking for quality of life of our patients who need stoma bags, or a rate of vaccination for our young girls who need it.
Sure. Sorry, I have to interrupt you because we're almost out of time. Let me just a final question, perhaps to Thanos here. So a lot of the discussion has been about things requiring a whole system approach change, which can be very daunting. Does it make sense to take a stepwise approach? And if so, where to start? Briefly, Thanos, please.
Thank you. We need another hour or two for this, but in essence, it is about aligning a long-term vision and the initial, even baby steps to go there. So think about path of least resistance, think about path of highest impact, think about path where there is a most measurable, directly measurable outcomes that can show the stakeholders that the system will benefit from this long-term vision.
Perfect. Thanks very much. And let me just turn briefly to the other panelists, just in one sentence. Tomorrow, the next step. What do you think is required, or what could you perhaps focus on in trying to drive greater innovation around cancer? Patricia.
I guess collaborating with all other European centers. I mean, a united Europe should bring this to everybody. And in terms of children's cancer or rare cancer, this is obviously the answer, but it's the same answer for most cancer problems.
Okay, and Tamara?
I would tackle hereditary cancer, 10% of all cancers, including childhood cancer, and I would identify more and better genetic mutation carrier to prevent the preventable and save more lives.
Okay, and Marie Miller?
I would say at European level and member state level, have a ground that encourage and rewards innovation, better use of our resources, reward sustainability, innovation that creates sustainability for the healthcare system.
Okay, well, thank you all very much to our panelists. I'm sorry we could have gone on much longer, and there were some great other questions that we didn't touch on, including the fundamental one about cancer survivorship and how that can contribute both to individual well-being and indeed reducing the burden on the healthcare system and society, and around the structural and legislative barriers and action needs to be taken both nationally and at the EU level. But a very helpful discussion. I think some very interesting ideas there about the potential for innovation, about the possibility of at least incremental moves towards greater uptake, and about some ideas including around focusing on outcomes-based or performance-related interventions beyond the traditional approach towards healthcare financing. So it remains to me to thank most of all our panelists. A reminder, thank you all to those of you who've been watching, that you can download this latest FPIA report, and this discussion will also be available on demand for people afterwards who haven't been able to join us live. So thank you all very much indeed, and goodbye.